Hi, my name is Tasha Carlock, and I'll be covering the prenatal precautions patient education video today. I will be starting by entering my patient's room. I close the door, secure the curtain for privacy. I perform hand hygiene. Hi, my name is Tasha. I'll be your nurse today. I'll have you verify your first and last name, date of birth. 2 patient identifiers have been performed. All right. So today the doctor mentioned that you're newly pregnant. Congratulations. The doctor did ask if I would come in and review some precautions that we recommend taking during pregnancy to ensure a safe and healthy pregnancy. Is that okay? All right. So we're going to start by talking about food. Most food is okay to eat during pregnancy. However, there are some that we do want to recommend avoiding. The big ones that are going to be things like raw or undercooked meat. You do want to avoid eating any seafood, eggs, as well as any unpasteurized dairy products, deli meat, hot dogs, or unwashed produce. All of these things can carry things like bacteria, which is like salmonella or listeria, which can pass through the placenta to the baby, and it does cause developmental issues like seizures, paralysis, and blindness, as well as it can cause preterm labor or even miscarriage. We are also worried about things like toxoplasmosis, which is a parasite that can cause an infection, and that can cross the placenta if baby gets an infection. Again, it can cause some severe developmental problems or even miscarriage. Additionally, some foods to avoid are going to be your high mercury containing seafood or fish such as like shark, swordfish, king, or mackerel. These high mercury content or those that impact fetal brain development can cause them like neurodevelopmental issues. We also recommend not having too much caffeine. You do want to limit the caffeine because it's shown to cause low birth weight or sometimes even preterm labor. There are some medications and supplements that are generally safe during pregnancy, but you do want to talk to your doctor before you start anything new or any supplements, just so that you could be sure to weigh the risk first before starting anything new or any supplements during your pregnancy. There is some medications that are okay, things like acetaminophen or even Tylenol that you could take for any pain or if you end up getting a fever. If you have any heartburn, you can take some antacids or Tums, for any indigestion, any antihistamines for any, if you're having any allergies, Claritins or Zyrtec. Those are things that you can take after your first trimester. There are some medications that we suggest avoiding. It's going to be like NSAIDs. That's like ibuprofen, Advil, naproxen. And these ones have been shown to cause birth defects when taken during your pregnancy. There are some other prescription medications that are contraindicated during pregnancy. That is isotretinoin for acne, any ACE inhibitors for blood pressure. But your doctor is going to go over this stuff with you and make sure that you don't have any contraindications. Also, aspirin. We do recommend avoiding unless your doctor prescribes it, as that can increase any bleeding that you might have. Some supplements are going to be your prenatal vitamins, which we do recommend. There are other supplements such as folic acid, vitamin D, calcium, iron. Those are all okay to take while you're pregnant. We do want to avoid any excessive vitamins and supplements, so any excessive vitamin A or excessive vitamin E. Any herbal supplements like sol palmetto or black cohosh have been shown to cause birth defects, so just be careful. Some environmental exposures to be aware of and avoid while pregnant is lead. Lead is found in contaminated water, as well as paint in like old homes. So if you have any home projects planned, maybe postpone or have somebody else do them for you. Lead has been shown to cause any neurodevelopmental issues in babies. Other exposures will include like excessive heat. So you do want to avoid any hot tub, hot baths, saunas, or any extended outdoor activities where it's hot and sunny and can cause any dehydration. It could cause dizziness or any low blood pressure. It can cause preterm contractions, and for baby, the excessive heat has been shown to cause neural tube defects as well as can cause a miscarriage. Other environmental exposures could be pesticides. So these could be found in your unwashed produce. You always want to make sure that you wash everything, any household products like your outdoor gardens, any yard work, things like that. So be careful when you're handling any of those, or maybe have somebody else do it for you. Pesticides have been shown to cause hormonal regulation disruptions with pregnant women, and you can inhale it, which could cause respiratory issues with baby. It can also cause some neurotoxicity and brain development in the fetus. Drugs you want to avoid, of course, always, like alcohol, tobacco, and they've been shown to cause miscarriage, preterm birth, maternal high blood pressure. Alcohol alone can cause fetal alcohol syndrome, which leads to cognitive impairments. It could lead to baby going into withdrawal. Tobacco can lead to low birth weight and effects in the heart and lungs that can cause long-term complications for baby, like asthma or ADHD, as well as SIDS. Drugs can cause birth defects like heart issues, lung defects, maybe even cleft palate, neonatal abstinence syndrome. So baby could be born and go through withdrawal symptoms at birth if any of these things are used. So of course, if you need any resources or any help, I can give you some of those to assist you, if you have any questions whatsoever. Travel during pregnancy, of course, if you are planning to travel, the safest time to do so is at your second trimester. So that's going to be like your weeks 14 to 28. Things that we do recommend while traveling is always to stay hydrated. Bring a copy of your medical records in case something happens while you're out of town and you need that information. If you are planning on driving, we do recommend that you limit to 5 or 6 hours in the car a day, that you take a lot of breaks, get up, walk around, as if you sit too long, it can cause blood clots in your legs. Some of the things you could do while traveling is you could wear compression socks, which will help limit any blood clot development in your legs. We also recommend avoiding high-risk areas out of the country, so places that have like Zika virus or malaria. And then you do want to consider limiting your travel during your third trimester when preterm birth or labor and preeclampsia are at like the greatest risk. All right, and then next and final will be dental health. So pregnancy can actually cause some dental complications. It can cause gum disease. You can get gingivitis because your hormones can change. You can get cavities, some tooth enamel erosion due to the different changes in your diet. You could also suffer from morning sickness, so a lot of the vomit and acids. So visiting the dentist and having procedures is safe during pregnancy, but of course we recommend doing those within the second trimester. Doing things like fillings and cleanings are okay, but x-rays, they can be performed as long as you have like the shields on. So that's all safe and good to do. All right, so let me know if you have any questions or any references, or if you need any resources for any of the information that we did go over. I know it was a lot of information. I appreciate you sitting here and listening to everything that I had to say. I'll go let the doctor know that we are done, and the doctor will be in shortly. Thank you.